2 years into a worldwide pandemic, and after decades of neglect from governments, we can no longer ignore what we've known all along. Mental health is health, and it's high time Ontario gave it the attention and resources it deserves. Sadly, there's still so much stigma when it comes to mental health, and Ontarians are facing more barriers than ever to get the help they need. The Ontario Greens Mental Health Plan will make care more affordable, accessible, and comprehensive for everyone. And we all know that preventing illness is a more effective path to overall health than simply waiting for a problem to arise. If we want to prevent illness, good nutrition, exercise, access to nature, and a safe, affordable place to live and work are essential. A true comprehensive plan for mental health starts with prevention, but there's more, which is why our plan will focus on immediate supports like youth mental health, addictions relief, reducing long wait times, more mental health services included under OHIP, and suicide prevention. And we will invest in more long-term supports like wraparound permanent supportive housing, improving employment rates, and decriminalizing drug use. Our vision is to build a more caring Ontario, and we can do this by investing in your mental health. Once again, Ontario Greens are offering a real plan for real action. So join me in changing things for the better. Let's solve old problems with new solutions and lead Ontario out of this mental health crisis together.
And here is the leader of the Green Party of Ontario, Mike Schreiner.
Merci. Bonjour tout le monde. Good morning, everyone, and thanks for joining us for this important announcement today. Before I begin, I'd just like to announce we have some fantastic candidates for the Ontario Greens in the room today. Diane Sachs, our deputy leader and candidate for University of Rosedale. Matt Richter, our education critic, candidate for Parry Sound, Muskoka. Sheena Sharp, our candidate for Don Valley West. And Nikki Ward, our candidate for right here in Toronto Centre. And I'd just like to acknowledge being in Toronto Centre, we are on the Treaty 13 lands of the Mississaugas of the Credit First Nation. And I'd like to reaffirm the Ontario Green Party's commitment to the truth and reconciliation process. I'd also like to take a moment before I begin just to say that the Ontario Greens stand in solidarity with the people of Ukraine and Ukrainian Canadians in condemning the senseless and lawless aggression by Russia. And just to say how inspired we are by the courage and bravery of the Ukrainian people. And we will continue to work across party lines to do everything we can in Ontario to support Ukraine. Today, I'm proud to be launching the Ontario Greens Mental Health Plan, Building a More Caring Ontario, which is the first ever standalone mental health platform put forward by a political party in the province of Ontario. And let's face it, everything is not okay. The past 2 years of the pandemic have unfortunately had a tremendous toll on Ontarians' mental health and well-being. The uncertainties of the cycles of lockdowns and reopenings, online school, the stress of taking care of sick loved ones, and the lack of access to supports. These are just some of the challenges and pressures people are feeling. Many people are struggling with addictions, anxiety, and eating disorders. According to the Canadian Mental Health Association, almost half of Ontarians have seen their mental health deteriorate since the pandemic began, and 24% of the people in the province have sought help for mental health challenges. And we cannot forget the severe impact of the climate emergency on mental health, in particular on our youth, which was highlighted just a few days ago with the latest IPCC report. There are reasons that health experts are calling the mental health crisis the shadow pandemic. Yet, accessing mental health care is far too difficult for far too many people in Ontario. 43% of Ontarians surveyed report that it has been difficult for them to access mental health care and supports. And let's be clear, this is not a new issue. For far too long, mental health has been an afterthought for Ontario governments, stigmatized and neglected. And this needs to change. We can do better. We will do better. The Ontario Greens have new solutions to this old problem, and I'm proud to present our plan today. Mental health is health. It must be a priority. And that's why we're committed to increasing mental health and addiction spending to 10% of the health budget and creating a dedicated ministry of mental health and addictions. Our plan will make care more affordable, accessible, and comprehensive for everyone, where mental health is treated just like physical health and adequately covered under OHIP. We're offering a barrier-free system where everyone can access the mental health care they need, where they need it, when they need it. Whether that means through a dedicated 3-digit crisis line, a local youth wellness hub, at or near schools, and in their communities. It's a plan for an equitable system that meets the needs of each person and addresses the unequal mental health outcomes in marginalized communities. Waiting to receive mental health care should not take months or even years, and it should not break the bank when you are able to access care and treatment. Our comprehensive plan will take an upstream approach to care, like ensuring that everyone has a safe and affordable place to live and work, and access to things like good nutrition and nature, because preventing illness is better and a more cost-effective path to overall health and wellness than simply waiting for a problem to arise. We will tackle and deliver complex care by providing coordinated treatment options within communities. And we will address addiction issues like the opioid crisis with expanded treatment and harm reduction efforts. Let's get real. Everything is not okay, but we can make it better by addressing the mental health care crisis as the real problem it is, with real solutions, by finally making mental health a priority in this province, because mental health is health. So let's get to work and start building a more caring Ontario, the Ontario we want. Thank you. Merci. And I'm now open to taking any questions. And we'll start by taking questions from the floor. Sure, yeah, whatever.
The idea of making spending 10% of the health budget on mental health, would this actually mean an increase to the overall health budget, or just shifting money from within the health budget over to mental health? And how would, if that's the case, how's that actually going to help?
Yeah, so it would be an overall increase to the health budget and an increase to the mental health budget. The recommendation of shifting to 10% is in line with the Mental Health Commission of Canada recommendations. And it's also in line with our consultations with the Center for Addictions and Mental Health, which has shown that while 10% of the disease burden in the healthcare system is a result of mental health challenges, only 7% of our current funding goes to mental health. So we would increase to 10%, which is really in line with the average spending of most OECD countries on mental health. And we would increase the base budget for community health service providers to 8% or by 8%. How we would pay for this, let's be very clear. It's a $6.4 billion plan that would first of all be paid for by canceling Doug Ford's short-sighted and ill-thought-out election gimmick to remove $1.1 billion a year from Ontario's budget with his license plate sticker gimmick. And additionally, it would cover the $500 million promised by the Liberal government to be dedicated to mental health spending. And we would do that in a way where we'd increase base budget funding to mental health and not use that money, as the Ford government often does, to either offset other expenditures or focus on debt reduction.
There, Alan Hale, Queen's
Morning,
Park
Alan.
today. Can you talk a bit more about where the 10% figure is coming from and how why is 10% the figure that has been chosen?
Yeah, so first of all, the Mental Health Commission of Canada it's in line with the recommendations. It's also in line with recommendations from numerous mental health care service providers and experts across Ontario, who have called for an increase in the base budget for community healthcare by 8% and an increase to 10%. That's in line with most OECD countries spend between 10 and 11% of their healthcare budget on mental health. And we think Ontario should do the same.
One other question in terms of actual tangible change that people would see. You say expanding access to mental health and addiction care under OHIP. What does this mean specifically? Would there be coverage for, say, psychological counseling? Like, could you go and actually see a therapist and have it actually covered by OHIP? What would the actual changes be?
Yeah, so we want to have the funding increase is to hire more psychologists, therapists, and social workers, have them available in hospital, in community, and through family health teams. So more people can access mental health services covered by OHIP.
Sorry, can I get clarification on that? So it doesn't necessarily mean that a person can automatically access a psychologist through OHIP, like you can go and see a doctor through OHIP. Yeah. Is that what you're?
That's our ultimate goal, is to make access to mental health services completely covered by OHIP. We know that we have to phase that in, partly because we have a health human resource issue in the mental health sector, just like we do in the hospital and the general healthcare sector. So we don't want to overpromise and underdeliver. So we will make money available over time. So more psychologists, therapists, social workers are available for people to access mental health services covered by OHIP. So yes, you will be able to access mental health services with your OHIP card over time.
All right.
Go ahead. Yeah, go ahead, Mike.
So you've said to me before, Mike, that you're acknowledging you're not running to be premier. You say it's not realistic to say that the Greens could form government. So what's your pitch about this in terms of how you would make this happen? Would this be the kind of thing that you would say you're only going to support a minority government if they put this in? If Doug Ford says he's going to put this in, would you give support to the PCs if they're in a minority? Like how are you actually going to make this happen politically after the election?
Yeah, we would make expanding access to OHIP services, mental health services under OHIP, and increase budget funding for community mental health services and supports. Part of our negotiating position, particularly in a minority government. But I think, Mike, we've already shown the Green Party's tremendous influence on politics, even with one Green MPP. So I'm imagining if these four candidates are joining me at Queen's Park, how much more influence we can have. And the best example of that is housing. The Ontario Greens released our housing affordability strategy last June. Many called it a masterclass plan. We received rave reviews across the political spectrum. The current liberal leader even said that it was a plan worth adopting in his convention speech. And now we have essentially every political party in Ontario talking about the importance of addressing housing affordability. This is the kind of influence that a political party that bases their policies on evidence, consultation with experts and people, in the case of mental health, with lived experience, to put forward evidence-based solutions and being honest about how we would pay for them. And we're going to continue to have that influence between now and the election day and after the election.
So this is the first standalone mental health platform. Can you explain why that is significant? Like, is that really much of the advantage?
I think it's significant because it's time to acknowledge in this province that mental health is health, that we have to dedicate the resources to making sure that everyone has access to timely, accessible, comprehensive mental health services. Prior to the pandemic, 28,000 young people on a wait list to access mental health services. Sometimes those waits are up to 2.5 years. I'll never forget a conversation I had on the streets of downtown Guelph with a teenager in the last provincial election when I asked him how he was doing. And he said, you know what, I'm doing okay today because I finally had a suicide prevention worker reach out to me. But it would have been more helpful if that person had reached out to me 6 months ago when I really needed the help. That's the kind of crisis we're facing in Ontario. That's why this plan is so important, because the people of Ontario deserve to have timely access to the mental health services and supports they need. And they deserve to have a government that's going to put in place the policies to prevent illness in the first place and to promote mental health and well-being.
Online now.
Thank you. We'll now go to the online questions through the Zoom. If you have a question, please use the raise hand function and I will call on you. First up, we have Adam Donaldson from Guelph Politico. Adam, please unmute yourself and go ahead.
Thank you and good morning. Mike, you touched on this a second ago, the human resources question, understanding we can't order more mental health workers from Amazon. How long would it take to staff up an expansion of mental health care like this?
Yeah, well, we think, given the feedback we've received from mental health service providers in the province, that with proper funding, we can ramp up access quickly. Children's Mental Health Ontario, for example, has said that with the proper funding resources in place, they can access staff that enable them to reduce wait times to 30 days or less for youth mental health. Part of the challenge is to making sure that all trained and licensed professionals are working within systems that enable them to work full time and be able to provide affordable services for people. Because one of the challenges that we're underutilizing our system right now, because even when people are able to access services and supports, oftentimes they're not able to afford them. And so that's why we have to address both accessibility and affordability.
And for my follow-up,
Good to know.
good to know. For my follow-up, we talked about the investment from the provincial side, putting this in place though, and understanding that a lot of healthcare money also comes from the federal side. Is there a lobbying piece of this to get more money from the feds to help cover this expansion if it were to come to pass?
Absolutely. I mean, that's why we're essentially saying the federal Liberal government has promised what would be Ontario's portion of mental health and addictions funding, $500 million a year. We want to hold them to that commitment. And we want to be very clear that that money will go to expanding and increasing supports and services for mental health and addictions. Far too often we've seen, and the Financial Accountability Officer of Ontario has shown that the Ford government has not spent federal funds that have been transferred for the purposes in which many times they haven't even been spent. And so we're making a clear commitment that we will work with the federal government to use that money in conjunction with the provincial money to increase investments in mental health and addictions.
Thank you. Just a reminder, if you have any questions through the Zoom, please use the raise hand function. I'm not seeing any more questions at this time. Back to you, Mike.
Yeah, thanks everyone. I absolutely appreciate everyone being here today, the questions. And I just want to highlight once again that everything is not okay in Ontario when it comes to addressing the mental health and well-being of people in our communities. And we have to treat mental health as health, make the investments ensuring that people have access to affordable, timely, complex, and comprehensive care, and that we make the investments in addressing the social and environmental determinants of health to improve people's health and well-being, which will ultimately improve outcomes and save money. So I'm looking forward to more in-depth conversations about how we can deliver the mental health and addictions care that people in this province deserve. Thank you.